Onc Live Insights is a video editorial program produced by Onc Live.
One of the appeals of the Optune device is its lack of systemic toxicity for the patient. Because the device is placed on the patient's head, the therapy is essentially localized to the tumor and to the patient's head, allowing the patient to avoid systemic toxicity, which might be associated with systemic therapies such as chemotherapy or targeted agents. Because of the lack of systemic toxicity associated with use of the Optune device, this particular therapeutic approach may be particularly useful for patients who have experienced side effects such as myelosuppression that may limit their ability to utilize systemic chemotherapy. Future applications of the Optune technology might include combinations with a variety of different agents and combinations with radiation strategies such as stereotactic radiosurgery.
So when you have a patient who might be a candidate for Optune or the tumor treating fields, or any patients who are not? Well, right now the device is not approved for patients who are pregnant, as we don't know any effects that might have on the fetus. But the most important contraindications are patients with implanted electrical devices such as a pacemaker, vagal nerve stimulator, deep brain stimulator. We don't yet know how the electrical device might interfere with the pacemaker or the deep brain stimulator right now. Other patients to consider not using the device are those who have a large skull defect. It's very difficult to apply the electrodes if there's a large skull defect. And then patients who have bad allergies to hydrogels, such as EKG lead pads. Because of the hydrogel, the sticky pad on the bottom of this, are the patients you really can't use this in. Lastly, the ones that we've had a little bit of trouble with are those who have had bad wound complications, who have very thin scalps and scarring, often don't do quite as well and have more wound irritation and wound breakdown. Those are the patients in whom we have to take them off treatment for periods of time or give them a little bit of topical steroids to get wounds to heal, but those tend to be the most complex. Aside from those sort of contraindications, the other patients that we try to avoid the treatment on are really those who, again, don't have a great family support network. The device is intensive, so if a patient is not doing well cognitively and can't participate in putting on the device, plugging it in, they're usually not a very good candidate for this. Similarly, if they don't have a good family support system, as often it takes a little help getting the electrodes on, getting some parts of the scalp shaved well, those patients tend not to do well. So the patients who tend to be best for the tumor treating fields or Optune device are those who are in better performance status, who tend to be motivated patients who have good family support around them. Because without that, it is somewhat cumbersome, burdensome right now, the way the device is designed. It's not to say that in 20 years it might be totally implantable with rechargeable batteries, but in its current iteration, it is a bit labor intensive and requires, as we would say, it requires a village to keep it maintained.